They are saying that this is the age of anxiety.
Anxiety, it's the number one disorder in the world. So why are we so afraid to talk about it?
There's so much shame associated with it. It's like there shouldn't be any shame.
Dr. Nafisa Sekandari joins Intentional Living with Courtney Myers in a stigma-stopping conversation.
I want you to get raw. I want you to get naked. I want you to get honest. Take off all the masks that you wear throughout the day and just talk about it.
Giving us tips on how to cope with our mental health. But you find a connection to your gut health with your mental state.
The majority of our feel-good chemicals is in our gut. And so when our gut is not healthy, it's not releasing those feel-good chemicals.
Take control of our emotions.
Think about it. If medication worked, all of us would just take a pill and be happy.
And live a life of calm.
I always say that if we're solid on the inside, if we're aligned on the inside, if we're grounded on the inside, it's not going to matter what's happening on the outside. And that is way more empowering than acting like it doesn't exist.
On an all-new Intentional Living with Courtney Myers. Welcome to Intentional Living with Courtney Myers, a podcast dedicated to those seeking a more fulfilled and purposeful life through thought-provoking conversation, spiritual exploration, and authentic connections. The intentional movement has begun, and if you found yourself here, you are a part of it. Intentional Living with Courtney Myers starts now. Hi, Dr. Nafisa. So happy to meet you and have you on the show today because we are going to talk about a topic that gets brought up a lot on this show. Anxiety, OCD, depression, mental health. It seems to be something really big going on right now, especially with women, and something I personally deal with. And a lot of the women I'm speaking to are dealing with a lot of issues in this field. So I am so excited to talk to you and get a real medical perspective, because I know this is your specialty, anxiety, OCD, helping people overcome it and actually live full lives beyond our mental health. I don't even know, problems, issues, illnesses, whatever we want to call it. But I'm so honored and excited that you get to share your wisdom with us today.
Thank you. Thank you so much for having me. I'm excited to have this conversation as well.
Well, what are you seeing today with mental health? Because I know you're coming at it from a lot of different avenues. You have experienced mental health issues yourself. You have experienced it with your family. You also talk about it in, minority communities. I know it's really important to you to talk about mental health with the Muslim community. And, I know in general, there's just a lot of unrest in the world. So what are you seeing with all of these different aspects of our mental health state?
Well, they are saying that this is the age of anxiety. I mean, we're all on the edge of our seats. There's fear of uncertainty. We don't know what's going to happen with the economy, with the Third World War. That just feels like looming over our heads. We don't know what's going to happen. Like even with 2020, with the pandemic, that came out of left field. None of us ever expected to go through something like that. And it just completely set us back, I think. And they do predict that the next pandemic or the next epidemic will be a mental health related one, because there is so much uncertainty and we're so connected to everything. Like before, in the olden days, we only had our family to worry about, our backyard to worry about, our local news to worry about. And now we're hearing about everything 24/7 if we allow it, right? We're doom scrolling late at night. We're not taking care of ourselves. We're exposed to more toxins than ever. We're not eating well. Our gut health is a mess. So all of that is contributing to this huge rise in mental health related issues with depression, with anxiety, with ADHD. And so a lot of us reach for numbing quick fixes, right? Like we might go for the alcohol, we might go for the marijuana, we might go for food even. And so we're trying to medicate ourselves, but we don't want medication, right? And so that's where I come in. I'm a holistic integrative psychologist, and I help my patients and my students online on how to overcome and get in control of our mental health related issues by taking care of our gut, by taking care of our improving our lifestyle, cleaning up our environment, so that when we take care of our gut and we take care of our brain, then our body will do what it needs to do for us, and it will keep us calm and grounded. I always say that if we're solid on the inside, if we're aligned on the inside, if we're grounded on the inside, it's not going to matter what's happening on the outside. But right now, none of it's in balance. And so we're constantly being reactive. And that's what's making us feel so on edge all the time.
So, do you associate a lot of these issues, a lot of our mental health issues, with our gut health, and really kind of, and then also what we're taking in, what we're absorbing energetically from the media or from online social media and things like that? Is that what's really contributing to our mental state? Or is it, are these real illnesses that our body is creating? Although, I mean, even when I'm saying this out loud, I want to correct myself because, I've spoken with enough doctors at this point now, is like disease is dis-ease, like we're creating it ourselves. So, I mean, like, I even want to take that back, but you find a connection to your gut health with your mental state.
Well, the majority of our feel good chemicals is in our gut. This is something as a psychologist I didn't know until recently, right? Like it's not something
Okay.
that's talked about that often. The majority of the serotonin that makes us feel calm, makes us feel happy, makes us feel at peace and relaxed is in our gut. And so when our gut is not healthy, it's not releasing those feel good chemicals. And so we think, and this is why we reach for the comforting foods, right? We reach for the
Mm.
carbs, we reach for the sugar because that does give us that release, that short burst of serotonin, because that sugar and the simple carbs convert to serotonin, but it comes with so many other issues. And so we end up getting diabetes, we end up becoming obese, we end up having, we're lethargic, we end up having a ton of inflammation in our body because we're using these things to give us that serotonin boost. We want that comfort food because we are anxious, we're trying to medicate ourselves, but we're doing the wrong things, is basically what, but we're doing the best we can because we don't know what else to do. Or we end up trying to calm our brain by numbing
Mhm.
ourselves with alcohol and with depressants to allow us to sleep. We're dependent on external sources to help us feel better. Yes, anxiety can be a really debilitating disease. It's a disorder, but it doesn't have to be. I linken that to if it becomes a disorder when we don't have control over it. It becomes a disorder when we make it worse by doing the things that we're doing. We're not getting enough rest. We're not allowing our body to rest and repair. We're not feeding our gut and our brain the nutrients that it needs to function properly. So we are contributing to this disease, just like we're contributing to our heart disease, to our kidney stones, to whatever. These things just don't happen. Our body wants to heal all the time. It's creating health all the time, but not if it's not being allowed to do that. And we're actually standing in the way. And like, for example, if we're consuming a lot of toxins, it really makes it difficult for our liver to get rid of all those toxins. It becomes blocked. And so when our liver is not able to process and get rid of the toxins out of our body, our hormones become blocked and our hormones go out of whack and everything becomes like sludge in our system. So when that happens, we are going to experience illness in a lot of different ways, whether that's physical illness or mental illness.
Wow, even just you bringing up hormones, I had a conversation the other day with another woman who was talking about that she thinks a lot of the anxiety or depression or suicidal thoughts or things that are happening in this world are linked to an imbalance of hormones. Now, she wasn't a doctor, it was just something she had started to explore herself. And and to me, I never really realized that, but now you're the second person to bring this up to me, is like hormone imbalance can be contributing to our anxiety or our depressive states or all these mental issues that we may be having.
Well, a lot of women in particular, probably men too, but a lot of women between the ages of 35 and 45 to 50, they get put on antidepressants and anti-anxiety medications
Yes.
because that's when they start feeling, oh my gosh, I'm feeling so anxious. Actually, I was 35 when I made the connection between my own anxiety, my own symptoms to actual anxiety and OCD. And so a lot of women get put on antidepressants, anti-anxiety medications. They go to their doctor. They're like, I don't feel good. I have brain fog. I'm not feeling well. Like, okay, take some anti-anxiety medications or antidepressants. But really, it's 35 is when our hormones naturally start to decline. And then between 40 to 55, that's when we're in perimenopause, depending on at what age you actually end up going through menopause. So that natural decline of hormones, if we're a healthy human being, natural decline is we're going to feel that, right? It's going to change our mood.
Mm.
It's going to affect our sleep. It's going to help make us be more reactive. It's like, think about PMS, right? If people have PMS, they're more moody, more reactive right before their period. And so a lot of those women, their solution is not anti-anxiety, anti-depressant medication. It's balancing your hormones. Because when you
Mm.
balance your hormones and you are taking care of your liver and you're trying to be as healthy as possible, menopause is not going to be an issue. But menopause is becoming a huge industry right now because that a lot of women are struggling because they've burnt the candle at both ends up until their 40s, and then all of a sudden perimenopause happens. They don't have the resources with the hormones to protect them, and then they hit a huge wall when it comes to menopause, and then they end up struggling.
Wow. That is fascinating because, what am I? I always forget my age. I'm 41 now, but yeah, it was in my mid 30s that I got put on my anti-anxiety, anti-depression medicine. It was mainly because of my overactive mind, my ruminating thoughts that I couldn't manage. I went through years of therapy trying to get it under control, which led me to anxiety and mild depression. And so, and I've gone on and off of it a couple times. I'm on it now. I would love to be on it, and I know you help people get off of it. But lately, just recently, I've actually started to suffer like anxiety attacks or panic attacks. And so I wonder if that is connected, like you're saying, to your hormones changing. I had two kids. I had them later in life. I had them at my daughter at 37 and 39. So, I've always kind of wondered if my hormones played with a little bit of it, coming back into, but, I'm now in that range that you said, in that 40 to 50 range, where I'm sure my body is changing yet again. And so this is definitely a new concept. And I don't think it's actually been talked about that much, how your hormones can have such an impact on your mental state. And if women are experiencing that, I mean, that to me is mind blowing if that's what we're experiencing.
Yes, and this is I'm a huge believer in getting a blood test. We need to
Mm.
not only get all of our sex hormones tested, and a lot of doctors will not voluntarily test them for you. You have to be an advocate for yourself and say, I want all the sex hormones tested. This is a great age for you to get a baseline of your hormones, because when you go into your 50s, you're going to want to know how much they've changed. And obviously, it's not about having the same hormones you did when you were 20. That's not going to
Mm-hmm.
happen, but you want to make sure that your hormones are at an optimal level for your age, so that you are functioning, you don't have that brain fog, you're able to rest, and you're able to uh, be able to function in a way that's healthy and productive. And the first thing to do is to get a complete sex hormone for women and men. A lot of men think, well, I only have testosterone, but they have
Yeah.
hormones as well. And a lot of men are estrogen dominant nowadays because of all the toxins in the air. And when you're estrogen dominant, guess what happens? Your testosterone goes way low. And so your sex drive goes down, your motivation goes down. You don't have the same energy and the same just joy for life that you had before. So men also have hormones, and it's really important to talk about that and get it tested. But that doesn't mean you go put on synthetic hormones. That's not the solution either. The synthetic hormones can cause more problems for us. But it's just a matter of finding somebody that is really good with the art of balancing the hormones. But it really starts with our lifestyle, with our diet, with our nutrients, with our stress level, managing our stress, with taking time, going to bed on time. I'm
Mm-hmm.
religious about sleep as well, and going to bed on time to be able to heal yourself and give your body a chance to heal, because your liver is doing a lot of its detoxing when you're in that deep coma like sleep. So you need to be in that as much as possible.
So, I mean, literally, our bodies are built to completely heal ourselves, and we are built to balance our own hormones as we grow. But because of everything we're putting into our system, we have almost broken the machine, and we need to get back to where we were. Because, I mean, if we think about it, back to like caveman days or whatever, like we were surviving without all of these artificial things we put into ourselves. And that's something I've talked about a lot. It's like, I don't understand why we think it's okay to continue to medicate and put all these things into our system. We are not built to function that way, but that is always the answer. And that is one of the biggest things. And I'm not like, don't follow Western medicine, But I think there needs to be more of this functional integrative medicine that we need to talk about, because we shouldn't just be putting foreign substances in our body to manage our life.
Right. And it's not just the medication that we're putting into our body, it's the lotions that have all of those chemicals, it's the shampoos, it's
Mm.
the skincare, it's the makeup. It's so much. Initially, you're going to feel so overwhelmed, like I did when I was diagnosed with endometriosis at 26, and that's definitely a hormonal imbalance issue. I mean, it
Wow.
did
Uh-huh.
everything. My hormones went completely out of whack. I gained a ton of weight. I had acne. I had like horrible cystic acne. My hair became curly, like it was straight before it became super curly. Crazy stuff started happening to me. And at that time, it's so weird. I was eating a lot of strawberries. Like I was obsessed with strawberries. And I was having strawberry shakes every single day. I was having strawberry smoothies. I was having strawberry everything. And at that time, I don't know if that's changed since then, but at that time, the pesticide they were using for strawberries was converting to estrogen for women. Like it actually blocks my own estrogen production. And I was absorbing the pesticides from the strawberries. That was just one of the things. I was also eating a lot of junk. I was eating a lot of processed foods. I was in college. I was living the college lifestyle. I
Yeah.
wasn't working out, so I wasn't giving my body and my liver a chance to detox and get rid of some of the stuff that was building up. And so I ended up 10 centimeter, huge centimeter, 10 centimeter cyst on my ovary that required surgery. But what introduced me to this whole way of being is I was a student. I didn't have insurance. I couldn't afford that surgery. And that cyst was so huge. I mean, I don't know, it's probably bigger than this. It was bigger than this. It was like a 10 centimeter cyst.
Wow.
And so it was the size of a grapefruit. And the doctors were like, this could burst and it could like completely destroy your reproductive organs. It could make you infertile. And I was like, I have no insurance. I can't afford this. So I was like, okay, let me figure something out. Against doctor's orders, I went and um, learned about this whole nother lifestyle. I got into acupuncture religiously. Acupuncture saved my ovaries. Herbs, I went and bought like hundreds of dollars worth of dried herbs, and I found this amazing book that helped me make teas and tinctures and sitz baths and all of those things. I literally took my life, my health into my own hands, and I started experimenting with myself. That in that year after I graduated, I got insurance, and I had to wait 3 months for the insurance to kick in. So by December of the next year, um, when I went and had when I went and had that surgery, it was such a beautiful, clean surgery. They just removed the cyst. My ovaries were perfect. My reproductive organs were fine. Nothing was damaged. Nothing got leaked. My cyst didn't grow. My pain during that year ended up calming down. I was able to actually handle it. My mood improved. I changed my lifestyle. So that's why I became so fanatical about this way of life, because it made
Mm.
such a huge difference for me. And then once I became a psychologist and I started seeing my patients and seeing so many of them on medication, I was like, there are psychologists that prescribe medication. There are certain states that allow for that, but I never wanted to go that route because it's so easy to rely on that and say, here, take these pills and let me know in 6 weeks how you're doing and we can adjust it as we go along. That is not what I wanted. I consider that as a band-aid approach. I medication has its place. It's for extreme circumstances, but I
Yeah.
would rather do the least invasive procedures first, the least invasive strategies first before even going towards that. So obviously, if all my tricks, my bag of tricks isn't working for you, then okay, you can try medication, but for a short time. It is not a solution for you to be on it for the rest of your life. Because think about it, if medication worked, none of all of us would just take a pill and be happy. Nobody would go to therapy. Nobody would want to work on their mental health because you just take a pill. But obviously, that's not the solution, because despite all the pills available, we're still struggling, and it is the number one disorder in the world.
Wow. That is fascinating, because I even think about it when you're talking about this. Like I said, I've had a couple panic and anxiety attacks recently, and I'm not actually currently seeing a therapist. I'm still on my medication that's prescribed. And so where I get my medication through, one of the services that's easy, the mail services. And, you fill out a questionnaire, and it's great because it allows you easy access to it when you're actually not in therapy. And I had one of these attacks, and I reached out to talk to a psychologist saying, like, I just want to make sure that I'm doing, because I never experienced it before. It was like, and I felt like I had like a week long hangover from it. You know, I've had a couple of them now, and each one that comes, I've actually learned to like manage my stress and my breathing and things through it. So it passes faster. But after the very first one, I reached out, and the response I got back shocked me. And I was so happy that I have like, I think things through a little bit more than just whatever they say. Their answer to me was, do you want to up your dosage? And I was like, are you freaking kidding me? Like, that is what is wrong with the world right now. Like, okay, well, just you didn't even ask me any questions. You didn't talk to me. You didn't dig a little deeper. To me, like, this is I'm just wanting to make sure like there's nothing I need to do more or go talk to a psychologist. Like, I just want to get to the root cause of this. And that just, it made me so angry that was the answer. And I didn't even have to see a doctor to up my dosage. They were just going to say, here you go, up your dosage. I didn't do that, and I'm fine. And I started taking, like you said, it into my own hands and taking a bath, doing my breath work, leaning into some more relaxation techniques, because I was just like, this is not right. I don't think that's the way that we need to go. But that is the answer always, I feel like now. How do we get away from that?
It's the simplest answer, yes. And what since you've gone through several panic attacks, have you noticed that, do you feel that it's not going to hurt you? Like, do you understand that while you're in the middle of a panic attack?
I think the first one, I was like, I didn't know what was happening type of thing. And it was like, and I had all these pains. And finally, my husband was like the one that told me, I think you're having an anxiety or a panic attack, because the way it came on and then the way it didn't like the pain I had in my arm and stuff, like, so we kind of read through the symptoms, and then I finally realized what it was. Now I actually catch it if it is coming, and I immediately go to my relaxation techniques, and I know I'm going to be okay. But that first one, the very first time, it was kind of like, what the hell is happening?
Well, the first one can be very traumatic for people. And so subsequent panic attacks remind them of that first one. And so that's
Mm.
why it escalates and gets worse. And I don't know where you're from, but at least here in the United States, at least 70% of emergency room visits are related to panic attacks, because people think they're having a heart attack. And so they rush to the emergency room, and it's just a panic attack. And
Oh.
so it's the first one that really terrifies us. And then follow-up sessions, follow-up panic attacks really freak us out, because we think it's going to be as bad as the first one. And that's how it just keeps escalating and getting worse.
Wow. Wow. And so this is like a real problem. I mean, you said it's the number one disease that we're dealing with right now.
It is. It is in the world. Yes.
Why is that? Is it just because of the state of affairs in the world, or is it, like you said, because of the outside things that are just in the system that we're consistently putting into ourselves?
I think it's a combination. Like for me, I know for a fact that it's genetic, right? I know it goes from my grandfather, my family members have it, and now I know my dad's side of the family, my mom, like we all have it. It's just definitely ingrained into our family. And I know a lot of family members that it's genetic. All you have to do is ask, it's like, who else in your family has this issue? And you're like, oh, well, my Aunt Sally used to drink a lot, or my uncle used to, have a gambling problem, or I like all
Mm.
of the there's different ways that you can go back into your family history and find out who else is having some mental health issues, and then see how you're similar. Like I even have a lot of parents bring their kids in, and they're like, I don't know where he gets it from. He's so anxious all the time. I don't have it like that. And I can understand why they don't make that connection to themselves, because although my family members range from like moderate to severe on the anxiety scale, I wasn't experiencing anxiety like they were. So much, thank God it bypassed me. I don't have it. But all of a sudden, after I became a mother, I started to make that connection. And I was actually in
Mm.
graduate school learning about anxiety, and I still didn't make that connection to myself, because we always see the extreme end. So if you're not on the extreme end, you're like, well, I don't have what they have. But anxiety can be so subtle and so creepy in different ways, and affect you in different ways of your life. For me, it was my mindset. It was affecting me in so many different ways. I wasn't out there having panic attacks constantly, but it was definitely holding me back. And so for some people, it is definitely genetic, but I know like it's still, I have it genetically, but I'm able to manage it through lifestyle, through diet, through nutrition, supplements, and all of that. And for other people, it could be just their lifestyle. There are
Mm.
such a mess lifestyle wise. They're not sleeping. Like a lot of teenagers are now more prone to mental illness because of their lifestyle. They're connected to their phone 24/7. They're not getting the rest that they need. They think that as long as they get 8 hours of sleep, they're okay. But it doesn't matter how many hours of sleep you're getting. If you're not asleep during that peak melatonin state, which is between 10 p.m. and 2 a.m., if you're not asleep during that time and you're not getting that rest and repair, you don't have enough melatonin to get you in that deep coma like sleep later on for the amount of time you need. So we need to sync ourselves back to the setting and rising of the sun. And when you like even
Mm.
with your panic attacks, looking back on it, look back to see what was happening, what happened before the panic attack, what happened during the panic attack, what happened after the panic attack, because we can also encourage these things to happen without even realizing it. So there's so many things that we need to pay attention to, and initially it might seem overwhelming, but once this becomes automatic, once this becomes a part of how you live your life, you don't even have to think about it anymore.
Wow. So when it comes, I mean, there's a couple things I want to go back to, but when it comes to sleep, we really need to be sleeping between a certain time period to hit that melatonin state that you're talking about. So it's not just like you said, getting 8 hours of sleep. It's about sleeping between certain time periods where our body really does our reset. Is that correct?
Exactly. This is why shift workers, people that work at night
Uh
and
huh.
sleep during the day, they are more at risk for all kinds of diseases. And actually, the World Health Organization considers it a carcinogenic lifestyle because it creates so many problems for ourselves when we're sleeping during the day and are working at night. So for my patients, like I have a couple of them that actually work for Amazon. It's like, and I think you get paid more if you work overnight
Yeah.
shift. I was like, it is not worth it. So shift workers have end up having all of these issues because they're not sleeping when they're supposed to. They might be getting 8 to 10 hours of sleep during the day, but they're not resting and repairing their bodies.
Wow. So it really makes a big difference, actually, the time of day. I mean, I can only think, my son was one of those. My daughter, came first and she was a great sleeper. And you always joke around like if the other one that wasn't a good sleeper came first, you might not have had that second. My son was my second, and I mean, the first almost 18 months of his life did not sleep through the night. And so I was up like every 2 hours. And it was to the point where there were days where I felt like I couldn't function. And now, as moms, we chalk that up to, we have a newborn. It's kind of goes with the territory. But I mean, he went obviously way too long with that till finally I think once I weaned him, finally I breastfed him, I think a little too long. But once I got him actually just like eat normal foods, he was sleeping through the night. But like it made such a difference in my everything about me. But I didn't realize that like it was certain periods of time that you really needed to sleep. And so if you are actually in a career or you're doing things like where you're working late at night and you're only getting 4 or 5 hours of sleep, it is actually harming your mental state more so than we really think, because your body's not allowed to function the way it's properly built to function.
Exactly. And another mistake we're all making is, well, they say even 1 hour less of your normal sleep. Like, let's say you normally get 8 hours and you get 7 or 6 hours.
Mm-hmm.
That's going to mess you up for the whole week. It takes a long time for your body to reset. And they're also saying that a lot of the research has shown that a lot of car accidents and heart attacks happen on Mondays because we're pretty scheduled and we have a pretty good routine during the week. We go to bed at a certain time, we wake up at a certain time, we go to work, we come back, we keep that schedule. But on the weekend, we completely mess that up. And so our body goes into jet lag mode. And it takes us a while to reset that because we end up going to bed later, we wake up later, and we think that that's okay. But why do people hate Mondays so much? It's because they've completely messed up their cycle. And so they're not functioning normally on Monday.
Wow. And then what also happens in that sleep state is when your liver really gets to work. So if you think about it, if you're masking your symptoms with things like alcohol, that's where that really comes into play. And even looking back at your family history, like you were talking about, is it's not necessarily genetic in the fact that everyone in your family has, panic attacks or shows up with rumination or OCD. It could be it shows in the form of, like you said, alcoholism and or abuse of things like that. So that all plays a part in it as well.
Exactly. Like in my family, there are some people that have panic attacks, but I've never experienced a panic attack before. So that doesn't mean I don't have anxiety. And so
Mm-hmm.
it's not just like everybody has the same symptoms. Kids show up differently with anxiety than adults, and this is why a lot of parents, they don't see, they're like, well, I was never like that, so they didn't get it from me. But then I literally had somebody tell me this. They're just like, my daughters are such a mess. They're so anxious. They need medication. And I don't understand where they could get it from. I'm like, well, are you anxious? Is your husband anxious? Like, not me. I'm totally calm. But within an hour, I found out how severely anxious this person was. And so they didn't even connect their symptoms to anxiety. They're just like, oh, I just get really overwhelmed sometimes. I'm really perfectionistic. I like to have things a certain way. I just have really high expectations, but I don't have anxiety. It's like all of that falls under anxiety. And so that's what a lot of people don't understand. And I want to normalize this conversation because a lot of us will call it, like I did, call it everything but anxiety. But once we call it what it is, then we can start working towards healing it and managing it. It's not a stigma. This is probably more common than we know. And this is why it's the number one disorder, because anxiety has a purpose in our life. I'm sure we all go through anxiety on some level. This is why I like to look at it as a spectrum,
Yeah.
low anxiety to high anxiety, but that doesn't mean I'm always going to be in this level. I might be on this end one day. Maybe I'm going to come back. So we're constantly going back and forth. But what freaks people out is when they all of a sudden, like you did, move into like the extreme where you're actually having a panic attack. Then that
Right.
overwhelms you. You're like, I never want to feel that again. Give me some meds so I never experience that again. And so that's what people don't understand and don't want to talk about it, because they feel like if I mention that I have anxiety, like when I talk about my family having anxiety, it's not like we're all
Uh-huh.
debilitated. Like you mentioned, high functioning women. We're very
Yeah.
high functioning people. I'm a very like the people that I work with and the book people that I wrote the book for, they're high functioning people that are overwhelmed, they're stressed, they don't know what they're doing, they're medicating themselves, they're numbing themselves, they're trying to not even think about the idea that this could be something that they have control over, because there's so much shame associated with it. It's like there shouldn't be any shame. We need to just call it what it is. It's like if I need glasses, I'm just going to go to the optometrist and get my glasses. There shouldn't be any shame about this conversation at all.
It really sounds like a lot of the things that we say, oh, no, we don't have anxiety, or I'm not experiencing that. Like you said, we're calling it something it's not. Like, it's just like, oh, I'm overwhelmed. Oh, I'm just stressed out, or things like that. They actually fall under anxiety. It's not all these other things we want to call it because we're so afraid of saying I have anxiety or I have depression or I have OCD. I mean, even saying like, oh, you're so OCD, it's like a joke, but no, like I have OCD tendencies. Like I have to look at the garage door has closed about 5 times before I feel confident that the garage door closed and I leave the house. Like that is not like, I don't even want to say normal, because like the moment we start saying normal or not normal, that's where we start getting into these stigmas, and it's not okay. Like it's just a thing I do. I know it's part of what I'm managing. But we get so flippant with some of these things, like, oh, I'm just so overwhelmed, or I'm just so stressed, or whatever it is, when no, there's actually a root cause of this, and it probably comes down to something like anxiety, and we can manage that by our lifestyle.
Exactly. And it's anxiety and OCD doesn't have to be debilitating for us to get help. It can be annoying, right? It's annoying to look at the garage door 5 times a day. It's annoying to
Yeah.
constantly worry about if the door is locked, but it's not stopping you from living your life. So you might not
Mm-hmm.
even bring that up in therapy. Like I've had patients when they come and tell me and I'm like, it sounds like you have OCD. It's like, I don't have OCD. What are you talking about? And then several months into the sessions, they're like, oh, I have to change my towels every single day. Oh, I cannot have this out of order. I can't. It's like, call it what it is. Like for me, it wasn't like it wasn't that I was, like I said, debilitated with my OCD and with my anxiety, but I, like anger, for example. I was very angry in my early 20s. I didn't understand that that was OCD related. But that's because I would
Mm.
get my mind set on something, and if it didn't go my way, then I would get angry about it. Road rage, that's OCD related. You're going along and somebody cuts you off and you have no control over that, and just and so when I used to work in the schools, I saw a lot of kids with that, and they would get diagnosed with emotional disabilities. They would be called all kinds of like, they would get severe diagnoses, but really they had OCD and their brains would get stuck. They would have meltdowns, they would have fits, and people didn't understand that. And at that time, I wasn't a clinical psychologist, so I didn't understand that either. I didn't understand that that's what they were getting stuck on. But now I love working with kids. I love it when they come to me and I teach them what's going on, because I'm like, I want you to be in control of this so that you never struggle like I did for most of my life. So that's why I have my little guy over here, that this is my OCD guy. And if we learn how to talk to it and talk to something outside of us, then it's a lot easier to tell him, no, what you're telling me is not the truth. It's not okay. But knowing that this little guy is constantly chattering in our head. So that makes it easier for us to understand it. But there's so many ways that this can impact us. But just like I did, I called it everything else, and you did, and everybody else
Mm-hmm.
is doing, just call it what it is. It's all under the umbrella of anxiety, and we can address it. And it's the same treatments work for all of them. It's again
Mm.
goes back to lifestyle, goes back to sleep. So when you're the next time you're having a panic attack, I want you to ask yourself, how much sleep have I been getting lately? How have
Mm.
I been eating? What's my stress level been like? What are the thoughts in my head that have been building up that now all of a sudden they feel really out of control and I'm panicking? What am I
Mm.
telling myself? What's my self talk like? And so when you do that, then you have a better idea, better understanding, instead of beating yourself up like, why is my body failing me? Why is my body acting this way? Stop it. It's almost like you're yelling at a child to stop acting a certain way,
Yeah.
instead of, what happened? What's going on? Are you okay? Did you get enough sleep? Like, I know with your kids, when their mood changes, you're just like, they didn't get enough sleep, they missed their nap, or they haven't been eating. We don't do that to ourselves.
Well, I wonder, I mean, and this is something, just talking about kids is, the way we treat babies, the way we treat our newborns with our health, with our nutrition, with the way they sleep, everything about that, we get so far away from that as we get in further and further into our life. Even with our children, we change that. We are so diligent in that first year or two of their life of everything that goes into their system, how much sleep they're getting, all these things. And then we like stop all of a sudden and we just go about our life and we look for the quick fixes or we take the easy way out and we don't really contemplate the stuff that we're consuming, what we're putting in, how we're sleeping, all of those things. They're all these very, very basic things that we don't bring into our life that we do as newborns. So like, do we need to take a little bit of that, like how we treat our babies, very, very, very young babies, and bring a little bit more of that self-care into our life to help manage the stuff so that it's not doesn't pop up?
Definitely. Like, on the one hand, OCD can be a bully and it can be annoying and it can be frustrating. But on the other hand, it's like a toddler. It just doesn't
Mm.
understand. It just says things. It freaks out. It's like Chicken Little, freaks out over the dumbest things. Just like your kid can freak out over you giving them avocados and they're like, oh my God, it's green. I'm going to freak out. Or putting them on glass and they start having a meltdown, right? And that's what's happening. It's like a meltdown of this little internal toddler inside your head. And so, just like with a toddler, you're not going to yell and scream at that toddler. You're not going to punish that toddler. You're not going to get worked up with them and freak out with them because they're having these irrational thoughts and fears. You calm them down, you distract them, you try to find out
Mm.
what's going on with them. Or did you get enough sleep? Oh my gosh, you haven't slept, so you're tired. Let's go take a nap and you're going to feel better afterwards. We say all that to those kids, but we don't do that to ourselves. And we need to have that compassion. But we also need to take better care of ourselves. We're not
Mm-hmm.
keep pushing
Mm-hmm.
ourselves and pushing ourselves and expecting our brain and our body to keep up. And I want us to love our body and our brain so much that we want to take care of it. It's not about hating our bodies. I mean, sometimes if we've gained weight or if we don't look a certain way or if we're aging, we get mad and we hate ourselves. That's not the answer. Our little
Mm.
bodies are doing the best they can. We take better care of our cars, we take better care of our phones than we take care of ourselves. And we just need to focus on
Yeah.
taking care of ourselves.
So if we take care of ourselves more, does that help fix the mind issues? I mean, like we talk about the mind, body, soul, or mind, body, spirit connection. Is that maybe where we're really missing the mark, is taking care of our physical being?
Well, when we're taking care of ourselves and we're eating right, we're less reactive, we're less stressed, we feel more grounded. But we might have to do all of that initially, right? We might have to change our lifestyle. We might have to do some grounding exercises. We're also not
Mhm.
breathing because think about it, when we're stressed and when we're
Mhm.
busy, we're breathing from here. We're not breathing from deep diaphragmatic breaths. And this is why
Yeah.
we have to force ourselves to slow down and meditate, which really could be just focus inwards and breathe for 10 minutes. We have to
Mhm.
force ourselves to do that because we're not normally breathing deep, slow breaths to oxygenate our brain, to oxygenate our body. Because think about it, if we're constantly in a fight or flight mode, we're constantly stressed, we're going, 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 and we're breathing here, we're not digesting our food. We're not able to get that deep sleep we need. We're not feeling grounded and present in the moment. We're constantly thinking about the future. But if we slow down and we take deep breaths, we're oxygenating our, because if we're running away from a bear or tiger, we're not, our body's not worried about digesting food or healing our
Yeah.
body or increasing our immunity to disease or whatever. It's in survival mode. And that's what most of us are in all the time. But when we're
Mhm.
calm or we're calming ourselves down and we're breathing and we're taking care of ourselves, we're sending a signal to our brain that we're safe, that we're okay. And so
Mhm.
then when the body gets that signal, then it can start repairing and healing and boosting our immunity and taking care of ourselves. Our hormones are flowing, everything is normal. But when we're going, 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 and we're not taking care of ourselves, that's when disease happens. That's when we get sick. That's when our immune system goes down. So it's not just spirituality, mind body connection. It's just a matter of, are we in fight or flight, or are we under calm parasympathetic nervous system where our system is calm and we're able to process information in a normal, healthy way?
I mean, I think a lot of us are living in fight or flight all day, every day. I think that has become the norm. And I don't know if that's because of the constant connection or the constant stimulation, but even talking about slowing down to breathe and have to remind ourselves, like, and I've talked about it on the show before, is like, I find personally, I will just forget to breathe. I will be holding my breath. I usually notice it when I'm driving. I'll at a stop sign and be like, wow, I've been holding my breath. Why am I doing that? Like literally I have to think and tell myself breathe. And so I mean it can be as simple as that, and I think that we do live in a society and we've almost embraced it. I actually had this conversation with my mom the other day. We were talking about going back to the generations and how parenting has changed through the years and how childhood has changed through the years, and she was saying that she feels that her childhood was probably the last time that kids could really just be carefree and be kids. There wasn't all this worry about keeping up or this competitiveness or what are you doing or what class are you taking or what activities are you doing. It was like the last time that life felt a little bit simpler because like then I grew up in the 80s and 90s. That's when things started to get a little bit more competitive. Now our kids are now in this new era, and parenting is very competitive, and there's all these rules and these things that we're supposed to be doing, and there's a lot of pressure. But if you go back a couple generations, like there was a freedom, there was more ability just to live, and maybe it is being more present in your life because there's not so much push for distraction and other things.
Not only that, kids are outside more. Kids are
Mm.
so busy and overscheduled right now. They're probably not
Hmm.
even breathing right. They don't have time to just relax. From the minute they wake up, it's go, go, go until they go hit the bed. And so we're not teaching them how to take care of themselves. We're not teaching them how to breathe and focus on their breath and calm themselves down. This is why when they implement any kind of meditation program into schools, kids do so much better just because of that 10 minutes of them taking that time to take a deep breath. For you, since you're noticing yourself not breathing in your car, you can put a little sticker that says breathe on your rear view mirror so that every time you stop, seriously, every time you stop at a red light or something, you look at that and you remind yourself to breathe. A lot of people are also putting alarms on their phones and they, at the top of the hour, 1 to 2 minutes, take a deep breath every single hour. That's going to make you way more productive than if you don't do that.
Wow. I mean, even like you're saying, the meditation for kids, I know with my daughter, she is prone to anxiety, and that doesn't shock me. She's only 4, but it doesn't shock me. I obviously have anxiety issues. My husband has his own issues. So like we are actually hyper aware of it with her coming into the world, and with our son, like we already like are looking out for it because we know we are constantly trying to better ourselves and work on it for ourselves. So we're taking that approach. But with her, we'll even pull out things like, I think the Calm app has like Sesame Street meditations and things like that when we're trying to get her to calm down or work through things. For some reason, she has a problem going to the bathroom sometimes. And so we'll give her the meditation, and it just will relax her and allow her body to do what it needs to do. But yeah, I see a huge difference, and she loves it. So like we've been trying to integrate that at a young age. And I think that is huge if we can try and help these practices when they're young, so it becomes, so we don't raise a generation of even more stressed out, anxious people than we already have are.
Exactly. No, and that's where it starts. We need to pay attention to our kids and give them the tools and the strategies at a young age and have these conversations with them and tell them that it's
Mhm.
totally possible. Even when I worked in the schools with kids that had learning disabilities, for example, when they would get
Mhm.
diagnosed with auditory processing or visual processing or some kind of a learning disability, they would feel really awful about themselves. But the thing is, we always already know there's something wrong. Like your daughter at 4 might know that I get really nervous, but she might not have the language for it. But telling
Right.
her the language and then saying, but this is what it is, and this is how you can work around it. This is how you can help yourself get better. And that is way more empowering than acting like it doesn't exist and then putting it under the rug and thinking they're going to outgrow it, because they don't. It only gets worse.
Well, and that's where that stigma comes in. That's where that shame comes in. That's where that not willing to be open about it comes in. So I think it's very important that we are open, like you said, and having more of these conversations. So how what are some tips? I know we've talked about in depth about different things, but like what are some really simple like steps that we can give people listening that might be suffering from anxiety or depression or OCD or any of these things that are going through, if they can't, go see a therapist tomorrow or get this help, like a couple tips just to like help manage these things.
The very first tip is to pay attention to your self-talk. So
Mm.
if it helps you to have a little guy like this to separate it from who you are and what your self-talk is, because there's our rational brain, the calm,
Mhm.
control brain, that that
Mhm.
knowing, that gut feeling that we know, that's our rational calm brain. When it's freaking out and it's loud and obnoxious, that's this guy. You need to understand what his language is. You need to understand what he's saying on repeat, because a lot of times the majority of our actions are based on programming from the age of 7. It's subconsciously programmed. We have collected and we were programmed at a very young age, and we're constantly acting out on that age level without even realizing it. So when we start paying attention to what is our self-talk, what's the automatic script that gets clicked in every time we
Mhm.
are facing uncertainty, we're doing something we're not familiar with, or that scares us somehow. What's going on? What's the language? Write that down, journal that out. Even just journaling. A lot of my patients,
Mhm.
I asked them, I'm like, did you journal like you're raw, naked, and honest in your journal, or like you're having lunch with a friend? And the majority are having lunch with a friend. Like, oh, I've
Yes.
been stressed a lot lately. It's just been stressful. I'm okay. That's what they put in their journal. That's not the kind of journaling I want you to do. I want you to get raw. I want you to get naked. I want you to get honest. Take off all the masks that you wear throughout the day and just talk about it. Get hateful if you need to. Get rid of all that, because the thing is, you're having those thoughts here anyway, especially when I was very angry about the world. I had a lot of rage towards everyone, and it's like I could have stuffed it and then it kept exploding, or I could just channel it and then just throw it away. If I just, let's say with you, I got in an argument with you, but I was like too polite to tell you how I feel, and I just kept shoving it in. My my conversation with you over time is going to change. It's going to build into resentment. I'm going to be passive aggressive with you. I might make sarcastic remarks to you. It might not be a genuine connection anymore because I'm sitting on all of this emotion. But if I
Mm.
get in and I'm like, I'm so mad at Courtney. She's just been so awful lately, blah, 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 blah. And I dump that in my journal. Then when I talk to you, I'm not going to be, then I can be like, well, that's real because she's really a nice person. And that's not how I genuinely feel. But at that moment, she hurt me so much that, or I felt hurt, that that's how I feel. But I know that's not how I feel about her. But once I get that emotion out, all that emotional charge gets out as well. And so
Mm-hmm.
then I can be more genuine with you. And it's the same thing with you and your husband, for example. You can get
Yeah.
mad at him and be really, really like upset and get it all out because you had that thought, like, oh, he's such a jerk. He's so selfish. You might not
Mm-hmm.
want to ever say that to his face, but in your journal, if you say that, it's over then. It's done. That emotional
Yeah.
charge behind those words goes away. So when we
Mm-hmm.
can keep the container inside of us manageable, we're not going to be so reactive. But a lot of
Mm-hmm.
us, we go around, we stuff because we're too polite. We don't want to say this. We're too intimidated. We don't want to say this to our boss. We don't want to say this to our coworker.
Yeah.
And you shouldn't sometimes because that could create a lot of problems for you, right? You don't want to just go around sharing your feelings with everybody. But in your journal, you
Mm-hmm.
can be completely raw and honest in that journal, and then you can shred it, you can rip it, you can throw it away. It doesn't matter because that act of writing diffuses that emotional charge behind those feelings and thoughts. So those are the two things. And then sleep is so important. Get consistent with your sleep. Sync yourself back up with the rising and the setting of the sun. Start getting up early. Stop sleeping all day. Get some morning light, because when you get that morning light into your frontal lobe of your brain, you're reactivating, you're resetting your internal clock. And so morning light is very, very healthy. It's not okay for us to be sleeping until 12, 1 in the afternoon. That is not okay for our body. That's not, we might be getting sleep, but we're not getting the rest and repair we need. Turn your phone off. Like my phone, everything, all my apps get disabled at 10 at night. My phone gets turned off at 9, but I turn everything, like everything just automatically goes off at 10 at night. I do have like a couple of things, like in case I need to send a text message, that's not disabled. My camera's not disabled in case I'm at a party and I want to take a picture, but everything else is disabled. Like I don't need to get on Instagram at 10 at night. I don't need to check social media at 10 at night. I don't need to check my email at 10 at night. All of that goes like, and I leave it in the kitchen. I don't take anything in the bedroom with me. If you
Mm-hmm.
need to have an alarm clock, buy one of those battery operated alarm clocks. That's all you need. You do not need to be tempted by this phone. I know this one of my patients, he gets up a lot in the middle of the night because he has to go pee. And then when he gets up, he's like, I'm just going to go on my phone. I have trouble
Yeah.
going back to sleep when I get up in the middle of the night too, but I'm not tempted to go on the phone. And it might take me maybe 5 minutes to fall asleep, maybe 10 minutes, but I do fall back asleep. But once you get on this phone, before you realize it, you're up an hour and you've just taken time away from your deep rest and repair. So that's another thing. And then I could just keep going on and on. Your gut obviously is really important, making sure that you're removing toxins from your environment. You're making sure you're making good food choices. Befriend the 3 pounds, trillions of bacteria in your gut. They are working so hard.
Mm-hmm.
They're your little soldiers. They're your immune system. They're working so hard for you every single day. Love them. Give them the foods that they need. Stop eating foods that, if you're eating like simple carbs, it goes right through. It doesn't give them anything to eat on.
Mm-hmm.
They have nothing to feast on. So you need to give them complex carbs. You need to give them fiber, lots of prebiotics, lots of probiotics, to just really nurture them, because when they're healthy, they're going to make you feel good. They're going to release all the feel good chemicals. You're going to be able to concentrate. You're going to be able to focus. You're going to be able to sleep. You're going to be less reactive. And so, at the minimum, those are the things that I would recommend.
I mean, it is so important what we're putting into our body, and they make it so I feel like it's not as accessible as it should be. Because I don't know why the powers that be would lose money, I guess, if it was easier to eat that way. But I mean, even I know during the beginning of COVID, my husband and I started following Dr. Stephen Gundry and the Plant Paradox diet. And we started doing that. During that time, I broke my foot. And it was so bad that it was like on the cusp of whether I was going to need surgery or not. And the doctor said, well, let's just try the boot and see what happens. And then we'll check it out in a couple weeks and decide if we need to go through surgery. I came back from my appointment and she looked at it and she was like, I have never seen anyone heal so well. And I chalked that up to the way I was treating my body, because our body can heal itself if we're giving it the right things. Now I've fallen off track. We're not doing Dr. Gundry anymore. I need to get back to it. I mean, but that was a physical representation of like just how feeding our body and letting our body do the work it is supposed to do can just make all the difference in every aspect of ourselves, and we can heal ourselves.
Yes. And I talk a lot about the placebo effect, and a lot of people are like, oh, that's just placebo. But how amazing your brain has to be to turn just a suggestion into a healing method, right? Just the
Yeah.
fact that you thought you were eating healthy and your body decides to say, that's enough for me to heal your bones and heal your foot. That's the
Mhm.
placebo effect is an incredible ability. Like it's an incredible insight into what our body is capable of doing. We should not dismiss that and act like it's nothing. It's minimize it. It's incredible and it's powerful. And we need to take advantage of it.
Well, even if you want to talk about it as the fact that we're all creator beings, we're all creating our own reality. So we're all living in a placebo effect if that's what you really want to get into.
Right, exactly. We believe it in some ways, but not in others. Like so many studies have shown that you can just take a sugar pill, and if you think it's medicine, it'll act like medicine for you. It'll heal you, and all you did was take a sugar pill. So
Yeah,
it's
I had
incredible.
a doctor friend tell me that all I have to do is decide that I don't need my anti-anxiety medicine and I can be off of it. But, it, there's a whole probably different discussion there about that.
Well, if you ever want to get off your anti-anxiety medications, I don't just let people just stop cold turkey. There are
Mhm,
so many natural ways, natural supplements,
mhm,
natural ways that you can start using so that you no longer need the anti-anxiety medication. There's so many natural supplements that work just as well as Xanax for anxiety that you only
mhm.
need as you need, you only use as you need it, but you don't need a prescription that you're going to have to take for the rest of your life. Um, so there, this is why in the 15 plus years that I've been in practice, I've never, like in the at least 10 years, I've never referred anybody for medication because I haven't needed to. The supplements and the nutrients and the things that we talk about, they all work so well, they don't need to get on medication. And the people that are on medication and they want to stop, I help them get off of it by getting into these natural supplements. But I would never say take the supplements and the anti-anxiety or antidepressants. I don't want that to overwhelm a body. Get off of one, but support your system so you're not feeling like you're left with nothing when you do decide to give it up.
That's amazing. So how do we work with you? I know you have courses. I know you have your podcast. I know you have a new book. How do we learn from you? How do we work with you? How do we get off medication with you?
Well, I'm limited to who I can work with. I'm licensed in Arizona and California, so I can work with those people individually. But because I'm not able to work with people around the country, around the world, I do have courses online that everything I ever talk about in therapy, it's all in my courses. And then, of course, I've written my book that just came out called Calm Within. Everything that I teach in my therapy or my courses, they're all in here. It's for people that want to have a holistic way of dealing with their anxiety, really create that long-term control of anxiety without medication or long-term therapy. I give them all the different tools and strategies that are included in this. It's available on Amazon. You can start ordering it now. I think it's available for pre-order, but you can order that. And then I'm on social media. I'm on Instagram at Dr._Nafisa_Sekandari. I'm on YouTube. I have a lot of videos on there. I put a lot of my podcast interviews on there. And my podcast is Mental Health Break Podcast. That's available on all the podcast platforms. And I do what you're doing, talk to a lot of different professionals about different ways for us to prioritize our mental health. And that's my goal, is for us to take a mental health break, focus on our mental health, and not just, because there are a lot of people that are so focused on their physical health, about getting
Yeah.
that back or being in good shape and being thin, but nobody takes the time to focus on their mental health. And that's my goal in life, is to make us all prioritize our mental health.
Well, I love it. It's obviously a topic that's near and dear to my heart. And I really do think, like you said, it is like one of those number one issues that we're all dealing with. And it is. I can't even tell you how many people I talk to that are dealing with some form of this. So It is so useful, so helpful. Thank you so much for joining me and bringing such great wisdom and information and tips to us. And I really look forward to hopefully working with you again.
Thank you so much for having me. I love this conversation.
And that's it for today's Intentional Living with Courtney Myers. Thank you so much for listening. And thank you, Dr. Nafisa Sekandari, for joining me in such a beautiful discussion all about anxiety, OCD, depression, things that I deal with, things that a lot of people deal with. A lot of people don't even realize they are dealing with it. It was such an eye-opening conversation all about how we can help ourselves navigate these things and really live the way our body is meant to live. If you want to work with Dr. Sekandari or get any of her courses or her book, or even listen to our podcast, I'll put all the information in the show notes below. And as always, you can find Intentional Media and Intentional Living with Courtney Myers on the website at CourtneyMyers.com, where you'll find our books, courses, and everything else we have going on. Can't wait to talk to you next week. Bye.